Good afternoon. My name is Marla McGuinness, and I will be your moderator for today's news conference. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you. Good afternoon. This is a difficult briefing today. We are reporting 2 deaths of COVID-19 in our province. One person in their 50s and the other in their 70s, both from the Halifax area, and both died at home from COVID complications. On behalf of all Nova Scotians, I want to extend my sincere condolences to their families and their friends. We are very sorry for your loss, and our deepest sympathies and prayers go to you and your families at this time. For privacy reasons, we can't reveal the details about these individuals, but we know that they died at home. We are reporting 153 cases today of COVID. And I want to tell Nova Scotians, if you're feeling symptoms from COVID and if you have difficulty breathing at home, please call an ambulance. We will waive that fee. Do not struggle at home and because you're worried about the costs. Get to the hospital. We are at a crucial point in this pandemic, and we need to continue to follow the rules. COVID and its variants are vicious, and we need to take this seriously. The science tells us so. People are sick and dying, and we don't want that in our province. We are 1 week into our shutdown. I want to thank all of you for working hard to follow the protocols and respecting the rules. We need you to trust that these restrictions will work. Today, we launched business rebate programs to help our tourism operators and our small businesses. It is my hope that this support will help you through this 3rd wave. Better days are ahead, and the vaccine is rolling out. As long as we have supply confirmed, we will continue to be ahead of schedule. When it is your turn, please book your appointment and get that shot. I'll turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And this is indeed a very sad day. 2 more Nova Scotians have succumbed to COVID-19. And these people are not cases or numbers. They are family, friends, and neighbors. To their loved ones, I offer my deepest condolences and prayers. To everyone watching today, I say this: the virus is deadly. 2 people have lost their lives and another 39 are in hospital, and hundreds more are sick at home. One of the people who died was not even known to public health as a positive COVID-19 case. Yet COVID-19 was found to be their cause of death after they succumbed. So if you haven't been paying attention before or are not taking this seriously, I hope that what you hear today changes your attitude. Many people have changed their lifestyles to protect themselves, their families, and other Nova Scotians, but some have not. And this is not the time that we can afford for anyone to be complacent. The illness we are seeing in Nova Scotia from the variants can progress quickly and give people severe symptoms, sometimes in as little as 12 hours. So please, if you need urgent medical attention, whether you know you have COVID or not, call 811 or 911 immediately. The disease may not give you time to wait. And as the Premier said, we've worked with the EHS. There will be anybody who calls with COVID or is suspected of COVID. We've waived the EHS fee for those individuals. And also, please make testing a part of your routine, even if you don't have symptoms. Assume you have been exposed and get tested on a regular basis, especially if you live in or travel into, for necessary reasons, the Halifax area. I'm pleased to be able to say that the lab and public health data entry backlogs are now cleared. Starting tomorrow, the case numbers that we report should reflect new cases identified in the last few days. Tomorrow marks the first full week of province-wide restrictions. And if Nova Scotians are doing what they're supposed to be doing, and I know most of you are, I anticipate that our case numbers will start to slowly decrease in the days ahead. So the next time you decide to do something that you know you should not be doing, please think twice about it. Make sure you are following the restrictions and following public health protocols. Think about the families of people who just died. Think about the fact that one of them died not even knowing that they had this deadly virus. And think about your own family and loved ones. Think about the people who may have to care for you or your loved ones in hospital, or sell you your groceries or take care of your children. This is not a joke. It isn't an annoyance, and it isn't a conspiracy. COVID is real, it's here, and it can kill. And it's putting our healthcare system that we all rely on for one reason or another at risk. So now is the time to step up and show that we care about one another in our communities. Follow the rules, please. Stay home, get tested, get vaccinated when you're eligible. We all need to do whatever we can to get to the other side of this outbreak without losing any more Nova Scotians.
We will now take one question and one follow-up from media in the amount of time that we have today. We'll begin with Carolyn Ray with CBC. Go ahead, Carolyn.
Hi there. I just wondered, we've heard reports from other parts of the country where people have died suddenly because of COVID-19, and this is a new thing that has been reported. Does it appear that these cases are that same pattern?
Well, these are both individuals. We know that they were at home, and they died or they certainly died in the community. And we're not sure of the course. We don't have all those details, but certainly they died in the community. And as a result, had to have autopsies done. And so I think it's fairly safe to assume if somebody's out in the community that their illness has progressed fairly quickly.
Carolyn, do you have a follow-up?
I know, Dr. Strang, yesterday you spoke to schools, but at this point, should people expect that the restrictions that are currently in place will be in place longer than the 2 weeks that they were initially announced?
Yeah, I think we need to look at where we're at, and we're in this for 1 week of the province-wide shutdown. We said it's going to be at least 2 weeks. We'll be assessing this very closely, but I think that's a fairly safe assumption that we're going to need to extend it for an additional period of time.
Next, we'll go to Jonathan McGuinness with CTV. Go ahead, Jonathan.
Hi, thank you. I'm just wondering, Dr. Strang, is there enough AstraZeneca in this province for everyone to receive their second shot?
So we're not worried about the second dose of AstraZeneca. We are delivering all the vaccine we have, including our AstraZeneca, as a first dose. We know that we have lots and lots of vaccine in the weeks and months ahead to deliver everybody a second dose. There's research going on about the ability to mix vaccines, so people who got immunized with AstraZeneca, there's research going on, and can we give them another vaccine? And there's a line of thinking that it actually may be preferable that people who their first dose is AstraZeneca may be preferable to give them mRNA vaccine as their second dose. So I'm not worried about giving how we're going to deal with second dose. There's evolving science and assurances of supply that everybody will be able to get their second dose with an appropriate vaccine.
Jonathan, do you have a follow-up question?
I do, yes, thank you. Are you anticipating a surge in hospitalizations and people admitted into the ICU following these spike in cases we've seen over the last few days?
Yeah, we absolutely know that there's usually it can be a 2 to 3 week delay between, as you see increase in cases, that is usually with a 2 to 3 week delay, an increase in hospitalizations, an increase in ICU admissions and deaths. And so the whole health system is working, planning for that likely occurrence and looking at what we can do to make sure that we have the capacity to deal with that. But that's why it's critically important that with the restrictions we put in place very early on, one of the key reasons we do that is to make sure that we can, throughout the whole pandemic, one of our key objectives has to be, even when we have an increase, is to act early. And to do that, one of the reasons is to protect our healthcare system as best as possible, to be able to manage the people that are ill within the capacity of our healthcare system. So along with the restrictions, that's also a critical reason why every Nova Scotian needs to be following all the restrictions. So we all of us rely on the healthcare system for one reason or another, and so we all need to step up and do what we can to make sure our healthcare system is protected as best as possible.
Next, we'll go to Elizabeth McSheffrey with Global. Go ahead, Elizabeth.
Hi, Dr. Strang. NACI has been in the spotlight today, overstating that mRNA vaccines are the preferred vaccines. I know that your messaging has been that Nova Scotians should take the first vaccine available, but I'm wondering if your position on that has changed, or if there are different groups of the population that should consider waiting for an mRNA vaccine over others, depending on the kind of work they do, whether, their amount of public exposure, previous health conditions. Should some people wait more than others?
So there's a lot in your question. First of all, NACI is not overstating the facts. All our vaccines are good vaccines. The reality is that the mRNA vaccines are better vaccines. The second piece is that we've always said Nova Scotians can have a choice. They've been given information around the unique safety risks of AstraZeneca vaccine. They've been given information around the difference in effectiveness on the vaccines. They've been given information about when they, in their age group, can expect to get an mRNA vaccine, and they can put all that together and make a decision whether they want to get AstraZeneca or wait to get mRNA vaccine. But I think, and I've never said that any vaccine is the right vaccine. I've always said that there are differences in vaccines, and we need to give Nova Scotians the information so they can make a choice.
Elizabeth, do you have a follow-up?
Yes, thank you. I'm wondering how planning and development is going to get Nova Scotians who have received their first vaccine in another province their second dose here. Some rotational workers, for example, are coming up on the end of their 105-day period in the next couple of weeks.
So we've got reciprocal agreements between different provinces that we've all got assurances that, and it works the other way. If Nova Scotians end up in another province when they're due for their second dose of vaccine, they'll be able to get that. Our focus right now is getting first dose of vaccine into everybody. There's good evidence for all our vaccine products. We always say that if you're delayed beyond what the schedule says, you should get your vaccine when you can, and there's no real harm from that. So we're going to continue to focus on first dose of vaccine for everybody. And then if we have rotational workers or others, when we start to get second dose and they're here in the province, they can get their second dose as well.
Next, we'll go to John McPhee with the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, there were two cases related to a residence at St. Mary's University announced this afternoon. Can you talk about the possible implications in the university residence setting, particularly since these cases aren't related?
So I don't know nothing about those cases, but local public health and Nova Scotia Health Public Health will be working closely with the university. Like anywhere else, we identify cases. We say, okay, where were you? And we identify people's close contacts. And if we need to do any close contacts, will be isolated. If we need to do testing within a residence or whatever, I'm just speculating. Whatever is necessary to be done to ensure that we're supporting both the quarantining and the testing of close contacts, we will do that in close collaboration with the university.
John, do you have a follow-up?
Yes, I do. Thank you. This is again for Dr. Strang. Do we know how widespread the variants are? Do they make up most or all of the positive cases that have been announced recently?
Yeah, there's always a delay in confirmation of variants, and we're not sending all specimens for variant testing, but I'm very confident and comfortable saying that we can assume that everything we have here in Nova Scotia is one of the variants. All our testing is showing that we do have the different variants, predominantly the B117, and all the pattern what we're seeing, very rapid, aggressive spread, it confirms that these are variants that we have here, like everywhere else across the country.
Next, we'll move to Michael Tutton with the Canadian Press.
Good afternoon. Dr. Tony O'Leary, the head of critical care, has expressed to the Canadian Press that we're on the edge here in terms of the fate of the critical care system. On the one hand, if there is public compliance and we flatten the curve, then some people might not be transferred all around the province. In other words, from Halifax. On the other hand, it could go the other way if we don't respond. Maybe to both Dr. Strang and to the Premier, how do you characterize the situation? Are we at a critical day, a critical point in this for the future 10 days down the road?
So I think we've been saying that for several days. We have a path. We're at a crossroads. We put things in place. Now, what path we end up on actually depends on how well people comply with that. And I don't disagree at all with Dr. O'Leary. This is a critical point. People need to understand how serious this is and the implications for our collective health and well-being. And if they somehow haven't clued into that, I don't know what else we can do. We've been hammering that message, the Premier and I, for the last few days.
Just to add to that, of course, we're concerned, and I spoke to the head of our critical care, and he made the point that it's not just the COVID patients. If we have patients that are of chronic conditions and their surgeries are put off, they're impacted too. So this impacts the whole system. So we've tried everything from cajoling people to educating them. We've increased the fines because we need a strong deterrent, but we need people to cooperate. And I do have faith in Nova Scotians, and I'd like to see a better compliance. And I think that our restrictions are working, and I think we'll see that in the next days and weeks ahead. But we do need to come together now. Michael, do you have a follow-up question?
To Dr. Strang, I realize there's privacy concerns and so on, but just to give the public a little bit more of a taste or a sense, what might lead people, or what, in the two cases we're talking about, to believe they don't need to go to hospital? Are the symptoms relatively mild or deceptive? What can you tell us about what may have led them not to think that they should go to hospital?
I don't know. I can't speculate on what maybe what happened in those individual cases, but what we do know is that this disease can progress very, very quickly. We've also were made aware that on Saturday, for some people, the financial requirement to when they call EHS was a barrier. So we very quickly resolved that within the space of a few hours. We put things in place to remove that and make sure that people with COVID or with symptoms that would suggest they have COVID, needing urgent medical care, that there was not going to be a financial barrier for them reaching out.
Next, we'll go to Madeline Bisso with All Nova Scotia.
Thank you. Dr. Strang, we set another record today. Are these huge numbers a little artificially high because we're working through the testing backlog? And do you expect that to change now that that's handled? Or?
So as we've been saying since last Friday, that we fully expected on Friday, if you recall, we said we were dealing with the backlog and we're going to get very high case numbers for the next few days, and that's exactly what's happened. Now that we've dealt with the backlog, we should start to see the impact of the province-wide restrictions over the coming few days, and starting to see a downward trend in numbers. But it's not going to happen quickly. It's not going to happen overnight. We have to have patience and work our way through this, but what it requires is everybody to continue to do what we need to all do together to keep each other safe.
Madeline, do you have a follow-up question?
Yes, thank you. Premier, Ontario recently introduced 3 days of paid sick leave in an effort to combat their outbreak. Will Nova Scotia do something similar?
So we're continuing to work with what we have. The federal program of the Canada Sick Recovery Benefit is eligible for people if they need to miss work. So to all the employers out there, I hope that they're continuing to be good employers and recognizing that when their employees have any symptoms at all, that they need to stay home. So that's what I expect to continue to happen in this province.
We'll move now to Adrian Blanc with Radio Canada.
Thank you. Premier Rankin, I talked to many representatives of businesses in the Halifax area, and they are not very satisfied by what was announced today by Minister Kousoulis. And they are suggesting, for example, no cap on grants that could be provided, no 5,000 cap, or that other departments get involved in supporting businesses, or identify gaps with the federal government in helping small businesses? Are you willing to talk more to businesses and see what else can be done?
Well, first of all, small business are the backbone of our economy in Nova Scotia, and we certainly understand they're going through tough times not being opened, and so we're doing a bit of catch-up from the previous restrictions, the real property tax rebate, so we pushed that out. That was to deal with the previous disruption, and then we got the small business impact grant together as quick as possible for this 2 weeks. We expect it's going to be longer than 2 weeks, but we're going to continue to make sure that we're doing our best to supplement. Keep in mind the federal government has programs for subsidies around labor and rent, and the impact grant is supposed to supplement some of that work, but the discussion will continue depending on how long this shutdown has to continue.
Adrian, do you have a follow-up question?
Yes, my question may be for Dr. Strang, but Premier Rankin can also address it. Many businesses are asking if once the situation is a bit better, you could allow opening of patios even before considering reopening dining rooms in restaurants. Would you consider that?
So that's certainly we've looked at that. We will look at that along with a whole range of things about how we start to slowly open things up when we're able to. Certainly we know that outdoors is safer than indoors, so that's a factor we'll look at in a whole range of things as we look to be, when we can safely start to slowly relax the restrictions.
We'll go now to Tim Bousquet with the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. Sorry, I was unmuting there. I guess I have a question about ambulance rates. It's a terrible situation that people are not calling an ambulance because of the price, and presumably people have died as a result. Wouldn't the same logic apply to other non-COVID related emergencies, and shouldn't we look at doing away with ambulance costs across the board?
Yeah, so there is a program in place right now for individuals under particularly income. There's a set amount that there is a waiver if there's challenges for the person that's using the ambulance to make sure that gets covered. We can certainly continue to look at that if that's the appropriate level. But if people need an ambulance, absolutely, they should have that ambulance.
Tim, do you have a follow-up?
Yes, Dr. Strang, I see a very large number of tests completed yesterday, by far the highest one-day total. So, kudos to the staff there doing that. And yet, I'm still hearing from people that say that they've waited upwards of a week, 8 days in one case, to get test results. Seems a little bit contrary to the backlog being cleared. Can you give some a perspective on that?
So, I mean, I think as we're clearing the backlog, people are being communicated to. I think we have to wait for a little bit. Starting tomorrow or today, actually, we should be in the place where, moving forward, that the majority of people will be getting their test results within the 48 hours. There's always a few outliers, but I think people have we asked them to have had a little bit of patience and understand the amount of work that's gone on in the last few days. So there still might be some people who haven't got their test results yet. That may be due, maybe there's a number of ways people get their test results. We ask people to give emails, and it may be sometimes you have challenges with emails, addresses being incorrect, or people don't give an email. There's lots of reasons there, but we are in a position to start to catch up. We just ask for people's ongoing patience as we work through the end of this and start to get back to normal.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you. We've come through our first week of the shutdown, and I know it hasn't been easy. For those on the front lines of healthcare who every day are risking their lives to keep us safe. For essential workers who keep our economy running. For parents working from home and homeschooling. For teachers trying to stay connected with their students through a computer screen. For businesses working hard to hold on. for early childhood educators who are taking care of our children, for grandpas and grandmas who are unable to see their grandchildren, for people struggling with their mental health, or for people that are experiencing deep isolation. For every Nova Scotian who is either getting tested or going out to get their vaccine or making a daily sacrifice to follow the rules of this shutdown. To all of you, thank you. And as your Premier, I am proud of this province and all of you. But for two families, today is especially hard. They are grieving the loss of their loved ones who died from COVID complications. As we continue with our day today, take a moment to think of them. And then take a moment to hold your loved ones close. Stay strong and do your part for our province and for each and every one of your neighbors. We will get through this together.